I'll assess the scene for any immediate sign of danger. If there's time, I would put on an apron and a glove. I'll do my hand hygiene according to the WHO guidelines. I'll pour an ample amount of gel, hand to fan overdose, fingers to talus, fingers to the low, fingers to the low, rotation with thumb, 6 the fingers, rotation the wrist. I'll allow my hands dry for 30 seconds. Hey, are you okay? Can you hear me? I'll do a trapezius pitch. There's no response. Help, and I'll press the emergency buzzer, and I'll come back to my patient, and then I would remove any pillows or anything to make sure the patient is lying flat, and then I would do a head tilt chin lift, and I'll open the mouth. If I suspect any spinal injury, I'll be doing a jaw thrust instead. So I'll be opening the mouth to see if there's any obstruction. If there's any obstruction, I will not use my hands to sweep it. I will use a yanker and a suction to suction it out. But for now, there's no sign of obstruction, so I'm happy to proceed. So I'll look, listen, and feel. I'll be looking for the rise and fall of the chest. I'll be listening for any respiratory noises, and I'll be feeling for any breath on my cheeks from the patient for 10 seconds. I start now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There's no sign of life. Hello, nurse. Please, can you call 2222 that we have adult cardiac arrest at the Osce Center, Northumbria, and if they can immediately come. Please, when you are coming, don't forget to bring the resuscitation trolley. Is that okay? Okay. Thank you very much. I'll come back again, locate myself vertically by the patient, make sure the patient is lying flat without pillows or anything. The patient is lying flat. I'll stand vertically by the patient, and I'll make sure I'll place the heel of my non-dominant hand at the center of the lower half of the sternum, and I'll place my dominant hand over it, and I'll make sure that I interlock it with my elbows locked and my hands straight. I'll be doing 30 compressions to 2 breaths. For the compression, I'll be compressing at a rate of 100 to 120 beats per minute at a depth of 5 to 6 centimeters, and I'll make sure that I don't lose contact between the heel of my hand and the sternum of the patient, making sure to allow adequate chest recoil before each compression. I'm happy to start now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And I'll be giving 2 rescue breaths. I would do a head tilt chin lift. I'll open up the airway, and I'll place the ambo bag, the narrow part around the nose, and I'll make a tight seal. All right, and I'll be giving 2 rescue breaths within 5 seconds, making sure that I compress 2 to 3 deaths, and then making sure that there's enough chest recoil, making sure not to overinflate the lungs. So I compress now. 1 and 2. Good. So I'll continue my compression with the same procedure. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 25, 26, 27, 28, 29, 30. I'll do the same thing. I'll do a head tilt chin lift, and then I'll place the back, making sure there's a tight seal. 1 and 2. All right, I'll come back again and do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 28, 29, 30. And I'll do another 2 rescue breaths, head tilt chin lift. I'll place the back. Okay, so 1 and 2. Okay, I'll do again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Give 2 rescue breaths, head tilt chin lift. And I'll place my back, make sure I have a tight seal, and then 1 and 2. All right, come back again. 4, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17.
Help has arrived.
Okay, help has arrived. All right, I'll be counting down to 5, then you can take over. Is that okay?
Yes.
Make sure the ambu bag is connected to 15 liters of oxygen. Is that okay?
Yes.
All right. 1, 2, 3, 4, 5. Take over. All right. So I'll be handing over using the S-bar. Using the S-bar too. When I had finished my duty and I was leaving, I saw these patients lying unconscious. There was no sign of life. There was no breathing or anything. I checked the patients, called here. There was no response, and I actually called the go to. That's why you are actually here to help. And in your absence, I've done 4 cycles of cardiopulmonary resuscitation with 30 compressions to 2 breaths, and the patient, there's still no sign of life, as you can see. I recommend that after the patient is stable, or when the patient is stable, if you can admit the patient to the ICU, and also to connect the patient to the monitor and monitor the vital sign. You can do a 12-lead ECG on the patient. I also recommend that you can you would do a chest x-ray on the patient. You can do a CT scan on the patient, neuro assessment, GCS assessment. You can do that on the patient. I also recommend that the patient you can get some IV line and administer all the IV fluids and everything for the patient. And then I'll make sure to also document everything that has happened here in the patient's case notes, and just for reference and everything. I'll also inform my nurse in charge about everything that has happened. All right. So for the 4 reversible signs of cardiac arrest, the 4H are hypoxia, hypokalemia, hyperkalemia, hypotension, and then hypothermia. And then the 4 T's are tamponade, thrombosis, toxicity, and then tamponade. If you need any assistance, you can let me know. If not, I'll leave you guys. All the best. I'll do my final hand sheet.